Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years and now doing the dental practice brokerage for 14 years. Today's topic is, under what circumstances should a seller and a buyer engage in direct negotiations concerning the sale of a dental practice? We're going to talk about that. As you know, we now have 10 employees. We're in 24 states, all to serve you. Call us at any time if you want some advice, suggestions, anything at all. We're more than happy to help you. We're available 363 days a year, and we just take off Christmas and Easter. So give us a call, 201-663-0935, and dentalpracticeguide.com is our website, or Nationwide Dental Practice Brokers. Okay, give us a ring. Now, also, as you know, this is all, if you're hearing any of this, is all for entertainment purposes. It's not legal or business advice. If you're thinking about selling to one of the DSOs, corporate dentistry, call us, because we can help you make a decision. We know many of them. We don't work for them, but they will often pay our commission. So that generally there'll be no commission to the seller. And we know who the best ones are, who's having trouble, who's losing employees. We know a lot of inside info. So call us so we could talk about that. Now, as far as another benefit working with us, all practices that are being sold for the seller legal fees, all practices being sold, we'll reimburse legal fees upon successful closing. So please give us a ring about that, and we could chat with you about that. Any practice being sold for $1 million or more upon successful closing, based on some small criteria, we will reimburse your legal fees. All right, give us a ring about that, and we can talk to you about it. Now, the topic today. I rarely suggest buyer and seller go into negotiations direct. I suggest you have the dental attorneys do it, and they do a wonderful job on it because they don't feel emotion in it. They make a decision based on business. So I've told you about this in the past. However, we have a circumstance. It's a general dental practice with a component of subspecialty dentistry. And right now, we're in the middle of negotiations. And the buyer and the seller have been chatting face to face, because what's different here is there's a lot of potential. Now, I know a lot of people don't want to pay on potential, but there's a lot of potential for the growth of this subspecialty practice, which is well entrenched in the practice right now. It's just taking it to the next level. There's a lot of great opportunities. And those opportunities, and what's unique about this subspecialty practice is the seller feels only he can explain. Also, the seller is a master lecturer, really knows the subject well of this sub dentistry. I mean, super well. And consequently, he's a good communicator about that. He or she is a good communicator about that. So under those circumstances, we have found, by the seller going into direct negotiation, he was able to bring the buyer along to get the price he wanted, at the same time negotiate the terms of the employment contract. And the seller truly feels that he can take the practice to the next level. So that's where we're at right now. The buyer and seller are negotiating directly. That's what it is. They're going in there directly. And I got to tell you, I think it's working out. It's working out quite well because of this direct negotiations. He's explaining to the buyer the potential of the practice, which you may not want to pay on potential, but, for example, somebody builds a brand new practice, that's 100% potential. So I feel you've got to incorporate a little bit of potential in it, and that's what he's doing right now. So it's really working out well. The two of them are getting along well. Again, always say you got to swing it back to the attorneys. But for right now, it really, really appears to be working substantially well. And we're going to let it run with it. Of course, we communicated with the attorneys to get their pulse on it. And they agreed under the circumstances it should be fine. All right. Please understand that this is a unique situation. We don't often do this, but under these circumstances, I believe it could work out very, very well. So call me. We could talk about this situation. But right now, it's working well. I do sanction it, and I think it's going to work out fantastic for everybody. All right. So give us a call. We can discuss all this and go from there. Thank you for listening, and hit the subscribe button if you like what you're hearing. Thank you. Bye.